Hi, my name's Lyle. I'm doing a handover for PPE 6 and this is my ID, and my ID number is 176311613. I'll now commence the handover. I am Lyle, a student registered nurse looking after Mr. Jason Bilko. While we're doing his handover as a team is currently in a med call, and this handover will be given to the senior nurse of that med call team. Mr. Bilko is an 81-year-old gentleman. His MRN is 123456. His date of birth is 1st of the 1st, 1937. He was brought in by ambulance at 1600 hours with shortness of breath and chest pain. Mr. Bilko has a history of multiple falls and a previous admission for unstable angina. He has no known allergies. In triage, he denied chest pain but still had shortness of breath. He was saturating at 82% on room air, and his respiratory rate was 32. On arrival to the bed, I attended to his observations again. At the time of his observations, I recorded his respiratory rate at 28, his saturation at 88% on room air, and a Hudson mask was applied with 6 litres of oxygen. His remaining observations were all between the flags. I called Dr. Lance for a clinical review for the saturation levels and his respiratory rate. ECG was attended and reviewed by Dr. Lance. Patient was connected to the cardiac monitor and was monitoring in sinus rhythm. Dr. Lance attended to bloods. He inserted an intravenous cannula and also ordered a chest x-ray. Due to a history of falls, I have completed his falls risk assessment and Waterloo. A falls risk sign has been placed at the end of Mr. Bilko's bed. At 1645 hours, observations were attended and between the flags. Dr. Lance charted intravenous fluid, so at 1705 hours, 0.9% sodium chloride, 1 litre was commenced at 100 mils per hour. Patient had gone for his chest x-ray, and on his return, Dr. Lance reviewed his x-ray. Dr. Lance diagnosed him with pulmonary edema. Dr. Lance also charted 40 milligrams of IV furosemide. This was given at 1800 hours. Observations attended again, and a change in Mr. Bilko's observations required a met call at 1801 hours. Observations at the time were BP 180 over 95, heart rate 125 beats per minute, and his temperature was 35.8. His saturation was 84% with 6 litres on the Hudson mask. His respiratory rate was 32. Patient has since been admitted under Dr. Turner due to his diagnosis of pulmonary edema. If you could please follow up bloods that were sent off earlier and speak to Dr. Turner to review fluids, as these may need to be ceased, and please just wait on further instructions from the Met team. And that concludes my handover. Thank you.